Local anesthetics. Local anesthesia is defined as a reversible loss of consciousness in a circumscribed area caused by depression of excitation potential or inhibition of conduction. Herein, circumscribed area is an important term because it differentiates local anesthesia from general anesthesia, which acts on CNS. What is meant by depression of excitation potential? Herein, the local anesthetic agents increase the threshold potential of a nerve fiber so much that many sodium channels are needed to be opened up, while inhibition of conduction occurs by blockage of voltage gated sodium channels. So basically, LA sets up a chemical roadblock between the source of impulse and brain. Say for here, the fuse of the dynamite is lit and it's soon going to explode the dynamite and it's going to reach the brain of the patient and will cause pain. While herein LA acts as a chemical roadblock and it does not allow the dynamite to expand, thus not causing pain. Coming to the composition of LA, the primary agent is the local anesthetic agent, which is lidocaine. It is a vasodilator, hence we need a vasoconstrictor to be added in the LA, which is most common used is adrenaline in 1:1 lakh proportion. Another is antioxidant or reducing agent, sodium metabisulfite. This is used to prevent the oxidation of adrenaline. Diluent is distilled water. Preservative is methylparaben. It's the most common cause of allergy. Fungicide is thymol and isotonic agent is sodium chloride. Before going to the mechanism of action of local anesthesia, we need to understand in brief of action potential. For a nerve membrane, the outer portion is usually more positive compared to the inner portion. But when it is stimulated, the inside becomes slightly less negative. And when it reaches minus 50 millivoltage, it is called as the threshold potential. Action potential is fired. This causes reversal of potential difference across the nerve membrane. Herein, the resting membrane potential of a nerve fiber is minus 70 millivoltage. When it is stimulated, some of the sodium channels are opened slowly and it causes a slight decrease in the potential difference. When it reaches the minus 55 millivoltage, which is the threshold potential, it causes faster and more opening of sodium channels. This causes sodium influx and this process is called as depolarization. It lasts for almost 0.3 milliseconds. After depolarization, the sodium channels close and it causes opening of voltage gated potassium channels, which cause potassium efflux. The repolarization lasts for 0.7 milliseconds. After repolarization, the inside of the nerve membrane becomes more negative than the resting membrane potential and it reaches minus 90 millivoltage, which is called as the potassium equilibrium potential. This is called as hyperpolarization. During this, the sodium potassium ATPase channels open and it causes efflux of 3 sodium and influx of 2 potassium ions. The yellowed portion is called as absolute refractory period because during this any amount of stimulus won't cause any action potential. But this green area is called as relative refractory period. A stimulus of increased intensity can cause firing of action potential. The mechanism of action of LA. LA is an acidic salt of weak base. LA is in an unionized form crosses the cell membrane because no compound in an ionized form can cross the cell membrane. After entering the cell, it becomes ionized because the intracellular pH is slightly lesser than the extracellular pH. Then it binds to the LA receptor on the voltage gated sodium channels in open state. This blocks the intraneuronal sodium conduction, that is from exterior to interior. The most accepted theory of LA is specific receptor theory. These are the 3 stages of voltage gated sodium channels. The first is the closed state. Here the gate on the exterior surface is closed. This occurs at the resting membrane potential. This is the open gate. It occurs during the depolarization. And this is the inactivated state. Herein this gate on the interior surface of this cell is closed. This occurs during sustained depolarization and it is a diffractory phase. No amount of stimulus can cause the generation of sodium action potential. Now coming to the site of action of La. Before that, we need to understand the cross section of a nerve fiber. So these are the nerve fibers. They are covered by a endoneurium. All these nerve fibers collectively form one fasciculi, which is covered by a perineurium. All these fasciculi together form a nerve and it is covered by epineurium. Now the site of action of La is endoneurium, while the main barrier of diffusion is perilemma, which is the inner surface of perineurium. Now the first effect of La occurs on small diameter fibers than large diameter, because small diameter fibers have increased cross section area. Myelinated than non-myelinated, because in myelinated nerve fibers the number of sodium channels is usually 20,000 per micron, while in unmyelinated it is 35 per micron. Autonomic, then sensory, and last motor, that is BCA. Stimulated more than resting. And mental, which are on the periphery of a nerve, then the co-fibers, which are located in the center. The clinical example is that the mantle nerve innervates the proximal area, that is molars in Inb. So when an Inb block is given, molars are anesthetized first and later on incisors are innervated. Last, order of loss of sensation. It is pain, cold, heat, touch, deep pressure, proprioception, motor. Thank you.